Survivors Joining for Hope came together with the incentive of essentially helping families that have lost someone by suicide. It actually came out of my brother's passing. When he passed away by suicide, I was kind of left floundering a little bit. When the organization came together, my initial thought was I couldn't find anyone that had experienced a similar loss to what I had experienced by suicide, and because there's a different stigma that surrounds the suicide at this point.
In August 2022, the Survivors Joining for Hope organization merged with Lost&Found to create a program. We added a CHW component, so a community health worker works directly with our participants. We've also increased our reach to be statewide and even into Minnesota and Iowa.
One of the biggest reasons that we became part of Lost&Found was we had reached our capacity. We knew that suicide is not an epidemic that we can take on alone. It has grown year over year. We've seen those numbers increase, and year over year, our organization capacity grew. But at one point, we reached that capacity.
So when people come into our program, what typically gets their foot in the door is the financial assistance piece, because they're looking for something to get them over kind of that one-time expense, whether it be the funeral fees or lawyer fees, to kind of get the all of the business that comes with someone passing away covered. After that, we're really looking at helping people. How can they move forward? So once the business is taken care of, how do they go back to their lives? Are there other resources that they need help with, other financial assistance programs that they might need?
I think on the post-vention side, it's the exact same scenario. When you lose someone by suicide, you do feel lost, you feel alone. I think it's bringing everyone together. You find this kind of peace, this cohesiveness that allows you to address your grief as a group and find that community to support you.
And how can we just help them grieve, get connected to their community? We work with other community partners to get them connected to peer support groups, things like therapists, things like community walks, and other ways that they can get connected. And so we really want to help them move forward.
Lost&Found, I think, serves many different directions, but I think it couldn't apply any better to both the post-vention and the prevention care I've found upon finding yourself from a mental health perspective and finding that community that's there to support you.